some outstanding issues. Democrats made an offer that was designed to resolve each of these outstanding issues, which involve proposed compromises on our part and theirs. As we always are at this point in the negotiations, we're in close touch with Republicans and Democrats on the Hill about this, and we remain confident, I should say, about reaching an agreement. And we're also interested in any Republican counteroffers. So I would say this is to be expected. We always know that there is some wrangling at the end of a process. I would tell you also that White House staff and negotiators worked through the weekend. As I think many of you know, the president worked the phones all weekend and is continuing to. We're encouraged as we reach the final issues that need to be worked out, and are confident about the path forward. So yes, time is not endless. We are certainly on a timeline here, and we will work closely with Leader Schumer to get it done.
Do you want to see something this week?
Well, I think we've certainly conveyed, and again, Leader Schumer has conveyed the need to move forward, and we are optimistic about the progress and focused on steadily moving forward, and we continue to see progress being made each day.
Second question on COVID. Is there any discussion at the White House at this point of President Biden getting a booster shot?
We would rely on the health and the expertise of our health and medical experts, and that's not a guidance that they are providing at this point in time. Go ahead.
Thanks. I know that you've said a lot about being guided by the science. Can you talk a little bit about the science that is driving the continuation of this kind of travel ban? The Delta variant is already dominant in the U.S., so how does keeping people from foreign countries out protect people in the U.S.?
Well, again, I'm not a doctor or medical expert. I think that that would best be posed to a member of the CDC or one of our doctors. But I think their decision was made based on the fact that the Delta variant is more transmissible and is spreading around the world. Yes, it is the dominant variant here in the United States. That doesn't mean that having more people who have the Delta variant is the right step. And also we see cases rising here at home, particularly among those who are unvaccinated. And again, they base their decisions on data, on health and medical expertise, and on a consideration of a range of factors, including keeping the American people safe.
And the scientists who are making these decisions are medical experts. Is the CDC that is making the decision? Who is making these decisions?
Yes.
Yeah. And I just want to make sure. And so, and also on a separate issue, when it comes to the issues of voting rights, police reform, there are civil rights groups, voting rights groups that are expressing frustration with the White House. They feel like it is not getting the priority that they feel like it should be, especially because of the rhetoric that has come from the president saying that this is, that these issues are, taking the country back, and that these are really some of the biggest issues since the Civil War, and yet they feel like there has not been movement and pressure to get something done, concrete, tangible, to get something done from the White House. What is your response to that frustration?
I would say the president is also frustrated. He wants to sign a voting rights bill into law. He wants to sign police reform into law. He believes both are long overdue. It requires Congress moving forward on these pieces of legislation and sending them to his desk. The role he can play is he's spoken out publicly about it multiple times, advocated for how this is a fundamental right people should have across the country is voting rights. He has worked in close coordination, as has our team, with civil rights groups and partnership, and he has conveyed to them, and I will convey again publicly, he is with them and stands with them in their frustration, their view that this is a vital step, but he needs Congress to send him legislation in order to sign it into law. I'm just going to jump around. Go ahead.
Hi. Jen, what's it?
Oh, no, sorry, I was going right here. They're Nadia. Go ahead.
Thank you, Jen. On Iraq, a senior White House official said that this strategic dialogue with Iraq is going to be the final one. So how does the White House envisage the relationship going forward? And how do you respond to criticism by Republican senators saying that you're capitulating to the pro-Iran militias by announcing this withdrawal as we expect later today?
Well, I think we feel this is a natural next step in these ongoing strategic dialogues, and that we are moving to a phase not where we are ending our partnership. We are maintaining a presence in Iraq with a different mission. in coordination with leadership of course, the Iraqi leadership, and one where we feel we can continue to be quite constructive in fighting ISIS and fighting the dangerous threats from Iranian proxies. So this is a shift in mission. It is not a removal of our partnership or our presence or our close engagement with Iraqi leaders. Go ahead.
Why has the president not nominated someone for FDA commissioner yet?
He is certainly eager to nominate someone. He wants to make sure we have the right person to nominate, and he's not going to do it at a pace faster than having the right person to put forward.
And has the White House had any additional staffers test positive for COVID-19?
I think, again, our policy, just to reiterate it, which we announced last week, is that if there's an individual who has close proximity to any of the 4 principles as defined by the White House Medical Unit in line with CDC guidelines on what that looks like, we will then make that information available and immediately public to all of you. So that has not been the case since we announced that policy, no.
And then just real quick, I know we've asked you a number of times about the mask recommendation for the vaccinated, and I know you have said overwhelming majority of the cases are in people who are vaccinated or who are unvaccinated. But what is the level of concern about infections in people who are vaccinated? Because we keep hearing reports of vaccinated people. Hospitals say that they're seeing patients who are vaccinated coming in. What is the level of concern in the administration?
Well, again, I think we all have a responsibility to be very clear about the data and what it says and what it does not say. 97% of hospitalizations are with people who are unvaccinated. That remains the case. The data from the health and medical experts still continues to be that if you are vaccinated, you are protected, and it's very, very unlikely that you will get sick, you will get hospitalized as a result of getting a breakthrough case. That remains the case in data. Of course, there are individual cases. We expect there to be breakthrough cases. We know there will be. More people who are vaccinated, the more as a percentage of individuals who are vaccinated who will get COVID. But the most important thing is that people are across the country largely protected from serious illness if they're vaccinated.
Can I just one quick follow-up? So the 97% number, so the CDC said that is from January to April. So that's a bit of an outdated number when you look at how many people have been vaccinated since then and the Delta variant. So why isn't there any more updated information coming from the CDC about what the risk is now to people who are vaccinated?
I can certainly see what their cycles of data is. We rely on data across the country. We don't rely on individual anecdotal cases that are reported because sometimes they scare the public without being based on broad swaths of information that the public should look at and look at the whole assessment of. And I think you've seen across the country, again, that and hospital leaders have said this too, that the number of cases of people who are coming in, the vast, vast majority are people who are not vaccinated. That continues to be the case from hospital systems across the country, but I'm certainly happy to see if there's more updated data that is available or when it might be available too. Go ahead, Steve.
Jen, I want to go back to this question about vaccine mandates. Has it been determined here that it would be inappropriate or illegal for the president to require federal employees, civilian or military, to be vaccinated?
It hasn't been determined that it would be illegal, no, but we have not made a determination about that, no.
So why not? I mean, the president today referred to the federal government as a model employer. It's the largest single employer of Americans, civilian and military put together. Why couldn't the federal government demonstrate to the country that model that you're talking about encouraging in the private sector?
Well, Steve, it is certainly prudent for the federal government to be looking at any steps, just like any employer is, to your point, of how we can incentivize people getting vaccinated, protect more people, save more lives. I just don't have anything to preview for you at this point in time. Go ahead.
Thank you, Jen. Does the administration view vaccine misinformation as a national security threat? And on top of that, is there any indication that there are malactors that are feeding misinformation in vaccines?
I've talked about this a little bit in the past. I'm not going to give it a new label, but what I will tell you and reiterate is that certainly misinformation is a factor. It travels through a range of mediums, some on social media, some on media, some through elected officials or public voices, unfortunately. And sometimes all of those pieces are connected to each other. That is a concern, a significant concern for us. Hence, we've spoken out against that. What was the last part of your question?
I wanted to know if the administration had seen the fingerprints of any kind of malactor, such as Vladimir Putin, feeding this misinformation?
I've said, I think maybe last week or the week before, that we did see some elements of misinformation around the effectiveness of mRNA vaccines previously from foreign actors, but I don't think we have a broader assessment than that at this
and
point.
Also, I want to ask you about the OMB director. Does the administration have any potential nominee to?
I know there's a lot of interest. I don't have any updates for you on that one. Go ahead.
Yes, Jen, wondering if you have any update for U.S. citizens overseas that have been patiently waiting to get vaccinated. Do you suggest they fly back to the United States, or should they wait in the countries they're living in? Will the embassies be doing anything more to assist them? Or vaccines that have been donated to countries, should a portion of those be allocated for Americans?
That's a really good question. I know that we haven't been working at this point to date that I am aware of through embassies on programs with American citizens. Let me check with the State Department and our COVID team and see if there's more on that. Yamish, go ahead.
Hi, thanks so much for taking my question. I know you've reiterated several times the president's following science. Can you talk a bit about whether or not he's concerned at all that the CDC might be taking too long to issue new mask mandates or even vaccine mandates now that we see cities like New York issuing vaccine mandates?
Look, I think it's important to take a step back and remember what we're talking about here. The CDC evaluates data from across the country, and they will make public health guidance. They will present public health guidance. They do that on a regular, periodic basis. They will continue to do that. And we are always considering a range of options, as we have been from the beginning of the administration. Of course we are, as we should be. They do not make laws. It is the guidance currently that if you are not vaccinated, you should wear a mask. It is the guidance currently that if you are over 12 years old, you should get vaccinated. And regardless, the most effective step we can take around the country is to get more people vaccinated. So that is where our focus needs to be, regardless of where the CDC may or may not land on any additional guidance.
When I talk to experts, they say vaccine mandates would be a big step toward getting more people vaccinated. So I'm just wondering, when you see organizations like nearly 60 coming out and saying, let's at least mandate health care workers being vaccinated, why isn't the White House behind that? What science is telling the White House?
I think I just said we support the step they took. What I'm getting at is the CDC does not determine mandates. The CDC provides public health guidance on what can save people's lives. Getting vaccinated can save people's lives.
So would it be fair to say then, I guess what my question is, does the White House at all see itself standing up, and maybe this is what you're saying now, yes, there should be mandates specifically for healthcare workers or teachers or municipal workers. Does the White House see that as a role that it should be taking in? Is there any danger in not doing that?
I think I just said a few minutes ago that we support the step of hospitals, and that was a guide and could be a guide for us on what to do with our own healthcare workforce here from the federal government, just to give you kind of a sense. I would also note that 90% of teachers across the country are vaccinated, and that is in part because of prioritizing teachers early, a number of them taking the responsible step, of course 90% of them, to get vaccinated. That would be up to schools and localities. There are certain powers that the federal government has, and there are certain powers the federal government does not have. But we're talking about a couple of different things here. One is public health guidance by the CDC, which will be different by data. That gives guidance. The laws will be implemented by others. They do not make laws. They give public health guidance. Then there are decisions by institutions, by localities, by hospital systems, who may make decisions about how they can protect their workforces. We certainly support that.
Actually, one quick thing on January 6th.
Sure.
I know you said that the president's going to obviously be busy tomorrow, but could you talk a little bit more about what the president thinks about these 4 Capitol police officers testifying before this committee? And does he have anybody else that he wants to see possibly testify if his goal is the same as Speaker Pelosi, as you said?
Well, certainly he relies on the leadership of Speaker Pelosi in moving this process and this independent investigation forward. And the individuals who will be be testifying were brave heroes on this day, a dark day in our democracy. The president absolutely believes that. I'd also note it's noteworthy that many of the Republicans in Congress who are the most vocal about supposedly supporting the police and law and order are the same ones who have dismissed and downplayed the shameful events of that day. I don't think that should be lost on anyone either, especially given about 140 individuals were injured that day. 100 law enforcement officers were injured that day, according to their own numbers and statistics. I think we have to wrap because you guys got to go and see the spray of the Iraqi Prime Minister. Thanks, everyone. See you tomorrow.
Thank you, Jen.